Hi, everyone. My name is Chiungyin Huang from Chiungyin Memorial Hospital, Taiwan. Our team members also include Dr. Guozhen Wei and Dr. Haoli Liu. Today, I'm going to talk about the preclinical studies on the potential of Sonosensitizer-Mediated Sonodynamic therapy for brain tumor treatment. Our target disease is glioblastoma. In the United States, there is about 4,500 new patients each year are diagnosed as glioblastoma. In Taiwan, it was about 600 to 800 patients per year suffering from the same disease. The prognosis of glioblastoma is very poor, although with very aggressive treatment, the median overall survival is only about 15 months. So, what is the main reason of the poor survival? One reason is the growth of the tumor cell is infiltrated into the normal brain tissue, makes it impossible to remove all the tumor cells during surgical resection. Another reason is the blockage of blood-brain barrier, which block more than 90% of the drugs get into the brain to kill the tumor cells. So, what is the weapons for doctors to deal with this disease? Let's see the standard treatment. According to the NCCN guidelines for glioblastoma treatment, the first step is surgery. The neurosurgeons proceed maximal safe resections to remove tumor tissues as much as possible. However, sometimes surgeons cannot remove all the tumor tissues because some tumor may located on the important neurological function regions, so it is not able to take them off. So it is need some other ways to clear these tumor cells. After tumor resection, adjuvant therapy such as radiation therapy and chemotherapy is needed to kill the tumor cells within the normal brain tissues. Up to now, temozolomide is still the first-line choice of glioblastoma chemotherapy, or other new choices such as immunotherapies and option TTF are also available. However, most of the patients still encounter tumor recurrence. When tumor recurs, patients will receive repeat surgeries or other therapies. So we need more new treatment to help these patients. Here, we want to ask, is there an adjuvant therapy that is safe, effective, and non-invasive? Ultrasound-triggered sonodynamic therapy may be one of the candidates for further glioblastoma treatment. Sonodynamic therapy is using sonosensitizers. By the energy provided from focused ultrasound, sonosensitizers may release free electrons that works with oxygen within tumor and the tumor cells, then create reactive oxygen species, then kill the cancer cells. Let's talking about sonosensitizers. There are many kinds of organic compounds that can serve as sonosensitizers, including porphyrin-based sonosensitizers, xylene-based sonosensitizers, and others. Among these candidates, 5-LLA and fluorescein are with great potential. 5-LLA and fluorescein are widely used as indicators for neurosurgeons to identify tumor regions during surgery. They can concentrate at tumor region and with low cytotoxicity, and they can be good choices for as a sonodynamic therapy. 5-LLA is a precursor of heme, but it can specifically uptake by the tumor cells and get into the mitochondria, convert to photoporphyrin 9. This is an and it can specifically accumulate in cancer cells and serve as fluorescence-guided surgery. Fluorescein is also an organic compound belonging to xylene-based dyes. It can preferentially accumulate in brain areas with impaired blood-brain barrier. So the selective accumulation in brain regions can also make it serve as fluorescence guided surgery. Both sonosensitizers are with great potential for sonodynamic therapy. So here we want to test these two sonosensitizers and its efficacy on tumor treatment. This is our focused ultrasound system for small animals. We have a water tank with ultrasound transducer, ultrasound bin, and the surface coil on it. And then we place tumor animals under the bin, the water tank, to receive focused ultrasound energy. The first one test is fluorescein. We use subcutaneous tumor model. In subcutaneous tumor model for fluorescein sonodynamic therapy, SD rate was chosen as animal model. Sonodynamic therapy was performed at 7 days after tumor inoculation. Then the tumor size was recorded every other day. Different ultrasound energy levels were tested. As you can see here, when combined with fluorescein, the tumor growth rate is significantly inhibited, and the best inhibitory group is fluorescein combined with 0.35 megapar focused ultrasound. Secondly, we want to test in a similar animal model the effect of 5-ALA for sonodynamic therapy. We also use subcutaneous tumor model, which we can see the tumor growth rate is also inhibited as compared with control group. This study also proved that the efficacy of 5-ALA mediated sonodynamic therapy, it can work. Then we want to know how sonodynamic therapy works on brain tumor. We move forward for brain tumor treatment. C6 glioma cells were implanted into rat brain. 7 days post-implantation, we checked the tumor growth by 9.40 MRI scanning and processed sonodynamic therapy with 5-ALA at the same day. Then the tumor growth rate was monitored by MRI every 7 days. We can see the tumor growth is inhibited. You almost can see the tumor in the treatment group at day 20, and the survival is also prolonged. This study indicates that the efficacy of 5-ALA mediated sonodynamic therapy for brain tumor treatment is very effective. We also check immunohistochemical staining for brain tumor tissues after sonodynamic therapy. As you can see, the Ki-67 expression is significantly reduced after treatment. Here comes to our conclusion. In rodent subcutaneous tumor model, both fluorescein and 5-ALA serve as effective sonosensitizers for sonodynamic therapy. For brain tumor animals, 5-ALA assisted sonodynamic therapy reveals significantly reduced of tumor volume and prolonged survivals. Preclinical animal studies suggesting sonodynamic therapy is effective for non-invasive brain tumor treatment. Here we are preparing the application of clinical trial for Taiwan FDA. We wish sonodynamic therapy can apply on glioma patients in the near future. Thank you very much.